There we go. All right, so welcome everybody. It is July the 7th. Can you believe it? My sweet mother's birthday is tomorrow, so I have to remember to call her. But welcome everybody. It is the Allume Town Hall. It is absolutely a pleasure to be with you here either right now in this moment or later on if you are listening to the recording. Lots happened, right, over these number of months. And I just want to thank you all for putting your heart and soul into delivering care to our patients and families, to each other, to the community. Really, really, really are heroes in this story. And I thank you for keeping everybody safe. The responsibility that you have is quite tremendous, and it's hard to even, we'll look back at this time where I hope that we have a fundamental shift in the way that we see healthcare and in the way that we see nurses in particular, the important value that you all bring to our collective quality of life. So today we've got lots of topics to cover, and I'm right in the middle of COVID, right? And I'm working from home, and I have a 12-year-old beaming at me, needing something. So I'm sorry. What is it, love? The link? It's in your, okay, ask Daddy to help you, okay, sweetheart? So onwards, so we've got a lot of topics to cover. So we're gonna talk about, let's see, our intentions, our current status, questions and symptoms, near horizon. We're gonna have, I have a lot of interesting information for all of you on PPE and what we found out from our survey. Some of it will be shocking and hopefully very helpful to us in learning how we can move forward and be safe. The next piece is we want to talk about the recent executive order that came out from Governor Lamont about travel. We want to talk about that and how it impacts us all. We're going to talk about the typical things we do to keep safe, remind everybody of the things that we are continuing to do. And then we're going to talk about 3-second improvements, which we launched and will continue to keep doing throughout. We're going to talk about 3-second improvements, some of the wonderful examples that came through. We had almost, I think we had like 60 3-second improvements that came through in the month of June, which I thought was a wonderful response. And I'm looking forward to seeing more responses this coming month as well. And so I have a slightly different version of the 3-second improvements I want to talk to you about. Performance appraisals, we want to get caught up. And we also want to get caught up on in-services. So we'll talk about compliance of performance appraisals and in-services, and remind everybody that we sent out a team survey. I'm going to send it out again. We got pretty good response, but I'd like to get more of you to respond to that. And just also some last sort of tips on remarkable self-care. So as you know, our intention is to keep our community safe. And it's moments like now where we have the ability to lead. It might be tempting to feel as though at this part in the journey, we're, oh, we're past the curve of COVID. Folks, we're at the first part of the journey. We still have a long way to go. This is not the time to become complacent, indifferent. It is not the time to sort of forget everything that we know about infection control. Now is the time to lead and to not go unconscious and step back from what we know is best for keeping ourselves and our community safe. So remember, our biggest risk is that we bring COVID into people's homes. We might be running around with it and not know it. We may be asymptomatic. We may go into somebody's home and someone in the home could be asymptomatic, and we could take it and transfer it from one house to the next. This responsibility is tremendous, and it is the biggest reason why we need to make sure PPE is the top of our list of personal disciplines and responsibilities that we just simply refuse to not follow through on. We have to be vigilant. So we need to, especially now where people are starting to come back out of their shells and the quarantine isn't quite as tight, it's going to be easy for us to go back into the community or for us to interact with people that could be carrying COVID. So let's just remember that we have a responsibility, and we don't want to take people, we don't want to take a dangerous infection into somebody's house. We want to remember personal protective equipment is at the very top of the list, along with diminishing all possible exposure and cleaning and disinfecting. So here's where, as of, let's see, the 5th, so the 5th would have been Monday, Sunday rather, this is the data. So we can see here that COVID cases have really, come down in terms of their total amount. There were a total of 46,000 cases, and the change was in the state of Connecticut, and the change since Friday was 259. Associated deaths were 3. Patients hospitalized with COVID has gone down. So that's good. Total of 69 are currently hospitalized for COVID. And you can see that we continue to have cases. We had an additional 24,000 cases, almost 25,000 cases reported. You can see the breakdown here as to as of July 5th. You can see the total COVID cases by county. And so you've got confirmed and probable cases and confirmed and probable deaths. So you can see that those are, they are what they are. You still can see the high points in which places have been most affected. So that's where we are. We hope to keep the curve flat, and we are doing everything we can to make sure that we can remain flat. So symptoms of COVID-19, as you know, you want to look for people, for yourself, with any kinds of cough, shortness of breath. We know about that. Look for also fever, chills, shaking with chills, muscle pain, headache, sore throat, loss of taste or smell. So again, continue to be on the lookout. Continue to have a lot of allergies floating around. Make sure that if you're experiencing allergies, you're checking your fever, you're taking something for it, so that you can ensure that your any sniffles you might be having are not COVID related. Make sure you are asking these 4 questions. This is really important. This is super key, because this is something that you all should know. We're going to be having a survey here in the next 3 months, 3 or 4 months. We're going to have a survey, and they're going to look and ask and make sure that we are doing this. Not only is it important to keep everybody safe, but it is important for compliance as well. It is a necessary thing. So please make sure you are asking these 4 questions at every visit. I can tell you that, my feeling is it's probably not happening. I challenge you to make sure that you do this. Ask them, have they traveled? Ask them if they have symptoms. Ask them if they've, had exposure. And continue to see if they've gone anywhere that may have widespread community-based spread of COVID. And then what do? You certainly ask the person to put the mask on, you put a mask on yourself, you put a mask on your patient, and you call the office and you look to speak to a clinical supervisor or administrator right away so that you can discuss next steps. So as far as how we're dealing with it as a company, we are continuing to operate in a quasi-virtual effect. So all of our direct care services, of course, are being taken place, in the home. We are doing some telehealth. I was on a phone call earlier today with a representative from the Representative Pettit, who's the head of the Public Health Committee and talking specifically about telehealth services and hoping to be able to keep those going ongoing. Part of what we want to do is make sure that we keep people very, very safe. So the office is open Monday through Friday. There's always at least 1, 2, 3 people there. A fulfillment team member is always there. And we're to answer phones, collect packages, and also for this very important purpose of distributing PPE. So really check in with yourself and make sure you have PPE. If you don't, you need to go to the office and get it, or coordinate with somebody else to get it for you if they're going to be in the office collecting PPE. As you know, many offices have opened with modified rules of operation. So that's happening. You'll probably have childcare and camps for your kids. Maybe you're starting to see some of that happening with modified operations. Just be aware as those things start to happen, if your children are participating in summer school or camps that or childcare, that your exposure is now increasing. So your personal need for responsibility around PPE has to really escalate in a similar fashion. We expect that the PPE rules will continue through all of the next 12 to 18 to 24 months, depending how long it takes to get a full either treatment or vaccination for COVID. We will continue to have as many meetings that we can virtually. We're limiting the number of people in the office, and we're asking members of the same team to not interact directly, so as to ensure that we do not have a whole team that serves a patient unable to go and take care of them. So this is kind of where we are. It's continuing on. PPE. So the short of it is wear a mask, wear gloves, wear a gown, and wear eye protection. Just do it at every single visit, especially if you're doing an aerosol producing procedure with a patient. Make sure that you have a gown on, and preferably have a gown on with an apron on top of it. So we want to make sure that you're super, super careful, super, super safe. So in every home, I want everybody to look and report back to your ambassador this week. Let us know, is there an emergency starter kit in the house, untouched, ready for use, should someone in the house contract COVID? Is there one in the house? That's an assignment for every single person here. Please reach out to your ambassador and confirm whether there's an emergency starter kit. Number 2, if there were to be a case, then we would want to hear from you, and we would then increase the volume of N95s, et cetera, and additional gowns that would be in the house. So make sure that if you hear of anything, you report it, to call the office and report it to the administrator or to a clinical supervisor. And number 3, understand your employee personal procedures, PPE. Want to make sure you have your adequate supplies. So ideally you have a few masks, you have a box of gloves, you have 2 cotton masks, you have an N95 mask that you can use whenever working with someone who's suspected or confirmed. You have and are using goggles. You have a gown that you're using. You have plastic aprons that you can use for when you're doing any kind of aerosol producing shit. Ask yourself, do you have all of these things? Do you have a few masks, right? So you should have at least 3 or 4 or 5, right? Do you have those, yes or no? If you don't, you need to reach out to your ambassador and figure out when you're going to come to the office and get them. Do you have at least 1 box of gloves? Do you have at least 2 cotton masks? Do you have an N95? Do you have and are wearing your goggles? And do you have at least 1 gown per patient you serve? And do you have a storage of 5 to 10 plastic aprons? If you don't, then you need to contact the office immediately, namely your ambassador, and coordinate with them, figure out the best way to get PPE to you. We are still asking care providers individually to come to the office to get your supplies. Now, you can coordinate with other members of your team, and so if I've got Amy and Julia and Perry who are all on my team, you can take turns, right? I'll go this month, you go next month, Perry will go the month after. We're still asking you to do that. The reason is we need to be very tight on the supply. We're just talking about this morning when I was talking to the state representative. We are sharing supplies with the whole country right now. So this is really important that we work together. It's the reason we're not just taking a big bundle out and sending it to the house, because what happens when we tend to do that is the supply is then liquidated before the end of the month, and then there's no supply left. So we really need to make sure that everybody really has their particular supplies. So everybody's personally responsible for their supplies, so you have enough, and that there's no worry about overuse and that somebody might run out and be unsafe. So please continue to come to the office or work together or talk to your case manager, see when they're coming, coordinate to see if they can pick it up for you, or work together with somebody in the office and work it out, and continue to make sure you're safe. So here's some disturbing news that we found when we did our survey. So, are you wearing gloves whenever you're providing direct care? So 95% said yes, and we had a small percent, 5%, that said sometimes. So 100% of the time, guys, wear gloves. Are you wearing a mask whenever you're in the same room as a patient at every shift? Oh my goodness, this is great news, because this is very important as far as COVID, being able to make sure we don't transfer it to each other. So are you always wearing a mask? 100% yes, that's great news. Please continue to do that. There. Next, are you wearing a gown whenever you're in the same room as a patient? So you'll see here, 30% said yes, 45% said no, and 25% said sometimes. So I can see why this might not be absolutely 100%, but here's where I want you to lean. For sure, anytime you're doing an aerosol producing procedure, put on a gown. You have one, just use it. I highly recommend, it's not required by the CDC, but I highly recommend that you wear your gown at all times, because it does protect you and it protects the patient as well. So like to see, as much gown use as possible. The other thing is we are starting to get more access to the yellow gowns, which I know are a lot more comfortable to wear than the Tyvek gowns. So when you come into the office, we can talk about, you can get and reuse a yellow isolation or blue isolation gown. Just make sure you have one for each patient you serve. Are you wearing a disposable plastic apron over your isolation gown when doing an aerosol producing procedure at every shift? So here you can see that the data, moving this thing out of the way, the data is showing that 25% of you are doing it, yes, and 75% of you are not. My sense is that most of you don't have aprons. And so I want to make sure, and this is a message to both those of you who in the fulfillment who are sitting in the office and delivering PPE, make sure you're, as well as to your care providers as well when you come in, make sure that you're getting the aprons, because they can also help protect you, and they also help protect having your gown, your isolation gown, be covered in germs. So please make sure you have them and use them. I was happy to see some of you are using them, but let's make sure everybody is. All right, next here is, are you wearing goggles or eye shield whenever you're in the same room as a patient? And so yes is 70%, pretty good. 25% is no, and another, I guess, 5% is sometimes. So you want to be wearing eye protection always. This is something that it's just do it. It is absolutely a part of what our policy is right now. It's what's recommended, and it will keep you and your patients safe. Do you currently have adequate PPE to wear a mask, gloves, eye protection, and a gown at every shift for the next week? In other words, do you have at least one surgical mask, half a box of gloves, one isolation gown, eye protection, and a few plastic aprons? The answer to that question was 60% said yes, 40% said no. So that told me that a lot of you don't have enough PPE. And if you are someone who doesn't have enough PPE, it is really important that you reach out to us, namely your ambassador, and figure out how to get enough PPE. So then we dug in a little further to figure out, well, what are people doing if they're not getting PPE from the office? And because I know that was something that had come up, and I've got this crazy thing I'm trying to move out of the way. And here's what we found. Other than going to the office, people are 80%. So the question is, have you personally come to the Watertown office to get PPE? 80% said that they had not, and 20% had said they had. So very small percentage of you have come to pick up PPE. This is disturbing to me on so many levels because it means you don't have enough PPE, and it also means you're getting it in a way that's probably not the best. So you're purchasing supplies on your own. Please don't do that. Please work with us to figure out how we can get PPE to you, or you come and get it. There are many there were already adequate supplies in the home. Well, if that's the case, great. Case manager brought the supplies. That's also great. Office delivered supplies. That's also acceptable as long as you have them. And then reused PPE. That's always a good strategy as long as it's not soiled or torn. Family provides the gloves, which is right. A lot of the families have certain supplies that are provided. Somebody's reusing their cotton mask and gown, which is also good. And somebody else picked up the supplies. These are all mostly good reasons, except for purchasing supplies on your own. Please don't do that. Please work together with us to find a way that makes it work for you to get the supplies to your case. All right, some more interesting data. So here we have that how many surgical masks, non-cotton, do you currently have? And so, one surgical mask can ideally be used for up to 5 shifts. So how many did you have? So 26% reported having no surgical masks. So that's kind of scary. 26%. One had, let's see, this little small percentage had 1 unused mask. Then we had 21% had 2. This slightly larger group over here had 3 unused masks, and then 4 we didn't have, and then 5 was this 38%. So some of you have masks, some of you don't. Just make sure that ideally you have some surgical masks. Now we also have the option of using cotton masks as well. And it looks like 73% of you have 2 or more cotton masks, and 10% of you has 1, but there's about 16% who have no cotton masks. So if you're in that percentage, please make sure you get a cotton mask from us, because then you have it as a backup should you ever need it. Okay, so gloves, 11% reported having no gloves. Make sure you have gloves. 32 reported not having a gown to wear. So if you don't have a gown, it's time to problem solve that. Get yourself a gown. So next steps, be sure you have adequate PPE. Again, it's especially in these times where exposure is going up, we need to really clinch down on PPE, especially now that we have it available. Make sure you have adequate PPE for every shift. Work with your care team to make sure you all have adequate PPE. So it's just not just you, but also other members of your team. Coordinate with your case manager, your ambassador, other nurses and home health aides on the same care team. Pick up the PPE in the office, call ahead, and protect yourself. Wear your mask, wear your gloves, wear eye protection, and wear a gown. All right, so the next topic is this travel advisory. So while we up here in Connecticut have had, we've had our curve, our COVID curve, start to really flatten. Other states are experiencing a big boom in COVID cases over these last weeks. They're now finally getting to their first wave. So as a result of that, on June 25th, Governor Lamont issued a travel advisory that requires travelers who enter the state with high infection rates on COVID to self-quarantine for 14 days after arrival. So, so if you travel outside of the country anywhere, or you travel to these, high level of risk places, that you need to quarantine, self-quarantine for 14 days. So this travel advisory says that a high infection rate is equal to when there's a positive test rate higher than 10 per 100,000 residents, or higher than a 10% test positivity rate over a 7-day rolling average. And so they're keeping track of this, and they're keeping track of a list on this website that's listed here. And so as part of that, we have to all align with that. We're asking you to please not travel to these places that are listed, because that will result in you having to self-quarantine. So these are the states that you can see as of June 24th. The green states you can travel to, the red states you cannot. If you do, then you will have to self-quarantine before you can come back to work. All right, so we want to continue to work closely with families and to limit their exposure, which is why we want to make sure that you are not traveling to these particular places. And we want to make sure that you are asking them the 4 questions and also holding yourself accountable to your questions. So the reminders here are that we have the travel ban continuing, right? So no travel to high infection areas. Those who travel to high infection areas must quarantine for 14 days before you can return to work. We are going to have a process in place where you will need to report where you travel when you travel, so that we can make sure that we're safe. This is something that we're responsible for doing. So we'll ask where you're traveling, what state, town, country. We'll continue to have our virtual meetings. I'll continue to encourage everybody to refrain from crowds. We ask that you do not shake anyone's hand, that you avoid meeting with others indoors as much as you can. I was on a call with the Connecticut Association earlier this week. A lot of nurses are, believe it or not, know that it's not appropriate for all of our patients, but a lot of nurses doing intermittent visits, behavioral health, different types of things, are doing more and more of their visits actually on a porch or outside on a deck, just because the exposure risk goes down dramatically when you are outside. So just something to think about in general when you can meet with other people outside versus inside, and it reduces your risk. Limit the number of people that you interact. Keep yourself in a tight-knit group of friends that you see. Avoid those who've been in crowds. Remember 6-foot social distancing. Clean and disinfect every 4 hours. Follow CDC guidelines for preparing your household. Notify your administrator of any known exposure. So if you've been exposed to someone that may have COVID, please reach out to our administrator, Marie, immediately. If someone else, like a patient or a family member of a patient, reports being exposed or suspected or confirmed, be sure to report that also to the administrator. And also, when you're ill, do not come to work. Don't go into the community. Continue to have the staff screening form that we send out every morning via text. Please continue to fill that out. Very important. Make sure you're washing, sanitizing your hands every 15 minutes. Make sure you're cleaning and disinfecting at least every 4 hours. And as always, masks, gloves, gowns, eye shield. All right, limited physical contact with other employees. We ask you to please refrain from getting together with other employees as much as you can. If you're going to see each other, please do so outside, and do so with PPE. So as a reminder, we have asked our families to coordinate with us. We've told them that you will be wearing gloves and masks at all visits, gown and eye protection at all visits as well. That we will be doing employee daily temperature and health screening, that we have an exposure risk assessment process, and that we have discontinued all overtime to avoid burnout and to also allocate resources for PPE. The required patient and family changes are the same. Everyone in the home must participate in the 4 screening questions every time a new nurse walks in the door. The 4 screening questions should be posted, and make sure it is near the patient bed. So self-quarantining was happening for all patients and all those living in the home, you know, continuing to just be very careful about limiting interactions out in the community. Agree to 6-foot social distance. As someone in the home is an essential worker, they must wear gloves and masks in the home at all times and maintain a 6-foot distance from patient and you. They need to fully isolate themselves from the rest of the family to eliminate direct exposure to patient or their family members if they're not going to wear PPE. We're asking families to have no visitors inside. Any visitor must be outside the home and maintain a 6-foot distance from anyone who lives in the home. And we're asking all family members to wear a mask when in the same room as a Allume team member. So just remember, these are the rules that are designed to keep you safe. Please let us know if you have a family that is not cooperating with this so that we can try to help with that. All right, next, 3-second improvements. So this has been really fun. 3-second improvements. So these are, okay, they are small changes that you make. Not me, not Marie, not Amy, not Kyle. You. These are things that you make that are actually an improvement. So it's really important the distinction here I want to make is that it's not something you're already doing. It's something new that you have done that you're going to implement that helps you do your job better, that creates value, that creates something good for someone else or for yourself. So they're small, consistent, which means repeatable, tiny improvements made daily by all of us here at Allume. And so each of us has what I'm encouraging to do is to think about how can I do my job better today than yesterday? What's one thing that I can do today that's a little better than the way I did it yesterday? Where can I make an improvement in efficiency? Where can I organize? Where can I create better connection? Where can I improve the outcomes? Where can I eliminate waste or cost? Where can I make things easier, simpler? That's what we're asking you to do. So there are lots of places where we could possibly need improvement. There's a long list here. We're doing this in order to recognize those of you in the field who are already making improvements every day, and we just don't know about it, and we don't get to sing your praises, and we also don't get to spread the knowledge. When you do something really cool and awesome for a patient, but you do it only for your patient and the rest of us don't know about it, then we can't spread that brilliance onto other houses, onto other families. So we want to identify what your brilliance is and share it. We want to know about it, we want to acknowledge you, and then we want to see how we can improve as a company because of your brilliance. So we had a total of 59 3-second improvements in the month of June, which I thought was awesome. And so this data is showing us what percentage of them had what effect, what kind of value did it provide. So 59% of them provided new organization, so it helped organize in some way. 66% created better effectiveness. 39% had created better connection between others. whether it's the patient or the team member. 40% improved communication, 33% enabled coordination, 57% improved outcomes, 71% made things easier, and 54% made things simpler. So you could have one improvement that does 2 or 3 or 4 of these things. So, and this gives you the data that shows you how the kind of value that was implemented through these 59 3-second improvements. And then who benefited? So you can see that, and I was really happy to see, this is great, that 79% of the improvements benefited teammates, other members of the team. You can also see that 69% benefited patients and 66% benefited families. 57% benefited care providers, which I thought was awesome. So you can see all the different people who were affected, clinical supervisors, the administrator, people who were doing things that were good for each other. And that, my friends, is really the intention. So I was happy to see that data. So again, I received 59 responses. I'm just gonna give you a couple of them that I thought were really fun to share. So one is, I decided to create a simple and easy to follow chart that informs nurses how to order the patient's monthly supplies. I made it for the awesome new night nurses to use as a reference. Brilliant, exactly right. This nurse took it upon herself to create something and put it in the house, some kind of a chart, posted it, now she's using it and others are. That's a great 3-second improvement. Here's another one. I purchased a dry erase calendar for all the nurses to utilize. On this calendar, every month we write down what day a med will be due for a refill or what days we need to order supplies by. We also jot down any upcoming appointments, and it's definitely made it easier for me as the other day shift nurse on the weekdays to keep up with med orders and prepare for upcoming appointments. Brilliant. This is great. This is exactly the kind of thing we want to see all of you deciding to do in the house. This was one that came from in the office. Fun crossword puzzle. I created it just for orientation so new hires can learn about Allume. I called it, How Well Do You Know Allume? Once they complete, they receive a card welcoming them to Allume and receive a lotto ticket. So again, this just came from somebody in the team who said, I want to make it better for new hires. Here's another one. I scheduled time to come into the office to learn about how to document better. So simple, but a huge 3-second improvement. Identified, this person identified it, that they needed to make some improvement, and they identified the way they needed to do that was to come to the office. And so that was great. This one, I wasn't exactly sure what it meant, but I'm sure it made sense to the team. So on Mars and TARS, move 11 to 7 in front spot, 73 in middle, and 3 to 11 on the bottom. See, to me, that's a great 3-second improvement where you're organizing things in a way that help to make sure everybody follows the system and process. The next one, label dresser drawers with pictures of what items of supplies go into each drawer. Awesome, right? So that's like, okay, here's how this can work and how we can all together stay coordinated, put things away in the same place. Creating and giving out an Allume mug full of Hershey Kisses to nurses who come by the office. This is another one that if you haven't been to the office in a while, then you haven't gotten a mug. But if you do, you might find that one of your fellow teammates made this a 3-second improvement. So these are great examples. Notice that they're all things that the individual did, that they're all new things that they did. It wasn't something that they had been doing, but it's something new that they started. And that it's specific, right? That you can actually say, okay, this is exactly what their 3-second improvement was. It wasn't vague, like, oh, I get my notes in within 24 hours. That is a rule, but it doesn't necessarily, it's not really a 3-second improvement unless you're demonstrating how you're getting your notes in within 24 hours. An example of a 3-second improvement to get your notes in within 24 hours could be that you set a timer on your, or a schedule, you put it in your calendar, time that you're going to complete your notes if you don't get them done during your session. So let's say that you have a 7 to 3 shift today, and you put in your calendar tomorrow morning between 8 and 9 a.m., that you're calendar that in, that you're going to spend an hour to get your documentation done. That would be a 3-second improvement. If it is a new method that you're going to use consistently, scheduling an hour to complete my documentation after every shift, that would be a 3-second improvement. Everybody got credit, no worries. Everybody who did them, sent them, everybody will get credit for them. But just as a distinction, that's what makes it a 3-second improvement. So 3-second improvements for the month of June. Everybody, so we had 59 3-second improvements entered into a drawing, and we said that everybody who entered one, for everyone who entered, you'd be entered into for the drawing, and $500. So Julia Davola is a winner of $500. Wow, that's a big bonus. So that will be coming later in the month to Julia in her payroll. But just know that everybody who submitted had a chance for that. So in July, I am going to invite you to continue to do 3-second improvements, but we're gonna sort of narrow down the focus. So here's where I want you to think about for 3-second improvements. So you can put in 3-second improvements for any of the reasons, right? But what I really would love to hear about is how you are, number one, creating a checklist of standardized care, customized and standardized care for your patient. So create a list of everything that should be done at a visit in your patient's house. And so make the list and send me the list. That's what I want. I'd love to see your list, your consolidated list, and take your time with it. That would be really great. Take your time to think about all the little things that you would do to make sure your patient receives the very best care, and that all the things that are supposed to happen in a visit gets done. Things like checking the go bag, checking supplies, organizing things, making sure you have inventory of supplies, making sure you look at the Mars and TARS. So think about what happens in the house where you are. Perhaps there's maybe there's a checklist with activities to do with your patient. So that's the first area, is to think about a checklist that you could create that really helps you go to work and not miss a thing. The second thing is new ways you can implement to ensure that Mars and TARS are accurate. So think about what you could do. What are some new behaviors that you could implement at the beginning, middle, or end of each shift to ensure the Mars and TARS that are with your patient are correct? An example, is there a checklist you could create that would help you review everything is correct? What things would you look for example? So think about that. How could you innovate improving quality and accuracy of Mars and TARS? Think about that. Number 3, new ways you can implement to ensure your documentation is correct. So what are some methods you could implement to review your documentation before you submit it? What are ways that you could, is there a checklist that you could say, okay, did I remember to check the go bag? Did I remember to educate and document? Was there any need for me to call my case manager? Was there any reason why I needed to coordinate care? So think about how you can improve your documentation and implement a system to help you do that. So it could be a checklist, it could be something you do in your calendar so that you know that at the beginning of every shift you do this, and at the end of your shift you do that. Think about how you can make 3-second improvements to focus on the customized care of your patient, ensure accurate Mars and TARS, and to improve your documentation. That's the big area of focus, three areas this month. So for every 3-second improvement that you fill out, so there'll be a form, an email that I'll send it out to you, and you'll have a form, you fill it out. 59 people responded to it last month. I hope we get another 59 this month. For everyone you share with me, you will get $5. So it doesn't have to be perfect, you submit it, you get $5, up to 50. And then you will be, everybody who participates, every time you submit a 3-second improvement, you'll be logged into the drawing for July. And the drawing in July is for $200. So I can't wait to see who will be the lucky winner. I can tell you that we've been working on these 3-second improvements with the fulfillment team, and I've already seen so many fun, exciting things come out of it. Lots of good things going on as a result. So I hope you'll find this a fun way to engage your patients, engage each other, and really sharpen your saw as a nurse. Compliance topics, next thing. So performance appraisals and in-services, always a challenge, I think, right? But very important that we get these items complete. As I mentioned before, we are expecting to have a survey, and while surveys are not the reason to do things, they do provide a reason to get our ship organized, right? It's like you're having company over and you need to clean your kitchen. So we're expecting company and we need to get ourselves in order. So performance appraisals, this is also really important because you need to make sure you're getting connected with your case manager. You need to make sure you're getting the support you need and having conversations with them. This is one of the many ways you can do that. Many performance appraisals are past due. So if you have a performance appraisal that is past due as of July 31st, you will be taken off the schedule on August 1st. We do not want to do that, but we are so out of compliant that this is also a danger to us. So to be compliant, employees must have current performance appraisals documented. Please remember, you might have a 6-month bonus that is waiting in the wings for you. So this should be a carrot for you. This should be a reason why you want to get this done. If you have any questions, please reach out to Taylor in Human Resources. So again, you just log into ADP, and I'll be sending out an email that has a reminder of how to do this. But you log in just like you would to any system. You go to My Team Talent Performance Dashboard, and there's where you fill out your form. Make sure you regularly click save as you're filling out the form so you don't lose it. And then you reach out to your case manager to schedule a performance appraisal meeting before the end of the month. I would actually recommend that you schedule this. Like, know that it's going to take you a few days to get the form done, but go ahead, reach out to your case manager, or they will reach out to you. You're both responsible for this, but get it done. Find a time to do it. You don't even have to meet in person right now, right? We've given each other permission to do it virtually, so you don't have to go anywhere. It gives you a little more freedom, but get it scheduled, and that would be the thing I'd want you to focus on. Sometime next week, have your meeting with your case manager. That way it'll be off your plate. Same with in-services. Many of you have May and June in-services that are past due. If you don't have your in-services done by the 15th, you'll be taken off the schedule. We don't want to do that, but we need you to get your in-services done. There's lots of good information in each of the in-services. Log into Elsevier, enter your name and your password. You'll see that on the left-hand side of the screen is a place that says My Activities Overview. You just click on the different trainings that are due, and then you'll see when you open up a training module that you go into the quick sheet and you do the training. There's all these other tabs at the top: extended text, supplies, videos, tests, checklists, notes. Kind of go through each one of those top ones just to make sure you don't miss anything in the module. You will always need to take a test. That's how the system registers that you've completed it. After you've reviewed all the training headers, then you take the quiz and then you return to the home screen to see if there's anything more. There's also a video which I'll send out that shows you how to do this. If you have questions, Julio is your man to help out with any questions. Please get your in-services done. Right now, this series, this is a big part. This town hall is part of the July in-service. So you are getting part of your July in-service done right now just by being here. Employee satisfaction, we have a survey that's going out. We're asking you questions like, what should we keep doing? What should we stop doing? What should we start doing? And what is your rate of satisfaction working at Allume? We've received several responses already. I'd like to get some more. We'll do a $5 donation to charity for completing the survey. Last but not least, please take care of yourself, right? Remarkable self-care. This is a time of year, it's, you know, this is a list you've seen before, so I won't go through it. But what I would say is take advantage of the summer months. Use this as a time to get outdoors every single day. It is critically important that we have time outside with the sunshine, with vitamin D. You know, we've been through a lot already, right? So this all started in March. But just be aware of the fact that this is probably going to go on for another year. So we need to pace ourselves. And in the summer months, we need to use this time to be outdoors, to when it's safe and when it's possible, interact with other humans, be social outside where it's safer. Use this time because, you know, we could be in a situation in December, January, February, March again, where it's cold out and we don't have as much opportunity to be outside and enjoy the warm sunshine. So take the time now, enjoy each other. Remember to use precautions, but, you know, find the joy of the sunshine as much as you can. All right, is there any questions, any follow-up you want to engage in? That's all I have left. I think I covered all the topics I promised. All right.
I'd like to say something from the fulfillment team.
Yes.
If anybody needs anything, aprons, cotton masks, gowns, please reach out to Jennifer and I. We're here to help and assist with whatever you need. Just give us a call and give us a, you know, a day or two, a day before, just so we can get it ready for you and we'll have it ready.
Thank you, Nanette. That's very kind and generous of you. And again, you know, to the team, I know it's really hard. We want to help. We want to be a part of the solution. Fortunately, we have wonderful people like Nanette and Jennifer who can help translate, right? So reach out to them and then we can problem solve and get whatever you need out into the field.
Coco, this is Jennifer Williams.
Hi, Jennifer Williams.
How are you?
I'm fantastic.
I also just wanted to remind everybody too that I'm here. If anybody has any questions on documentation or any issues in the home, please email me. And I will get back to people as soon as I can. I know I'm not always visible, but I am here if anybody has any questions about any education stuff in the home.
Oh, that's awesome. Thank you, Jen. Marie, do you have any other any comments, anything else you wanted to communicate to the team, or Kyle or Amy or Christine, Jennifer?
Well, I would just like to say, you know, thank you for everything that you all do every day. You're our frontline people. And again, you know, some of you do reach out to me and ask me things, and that's what I'm here for. But if you ever need anything, I'm always available.
That's the truth. Marie is like the person, if you call, ask her for help, she'll help you. I know from personal experience. All right. Anybody else?
Elsevier, anyone just can email me. They have my phone number. Whenever they email me, I always email them, I'm sorry, the phone number, so we could get in contact and just give them over the phone support. Sometimes it's better than just reading off an email. So they always know I'm here as well.
Thank you, Julio. Thank you so much. And I know Taylor's out today. She's on vacation, but I know she's also wants to help with regard to the ADP performance appraisals. And so, you know, if you have questions, you're having trouble, I know the system's been a little tricky to get used to, please let us know. We want to make it easier for you. All right, guys. Well, I think that's it. I appreciate your time today. I hope you have a wonderful, wonderful day, and you know, do something nice for yourself and for your family, and something that brings you joy. And you know, think about your patients, and you know, hopefully you'll reflect some love and gratitude into their hearts, and make the world a better place.
Thank you, everybody.
Thank you. Thank you. Bye.